Hello, everybody. Thank you for joining us. We're going to talk about our annual benefit open enrollment beginning January 1st, 2026. Just to let you know, we are all here to help you. The first place to start for help is going to be with your HR department. You're very familiar with them. They do a fantastic job. Also, we are available to you should you need one-on-one conversations and one-on-one help about what plan works best for you. So we are here for you in addition to your HR department. They can get you to us should your needs go beyond what they are able to handle. So definitely here to help. Quick agenda. We'll talk about our timeline. We'll talk about medical, dental, vision. We'll talk about enrollment. Where do you go with questions? So we'll do all that. And I'll welcome you guys to chime in if you have a question during the presentation. I bet you other people have the same question, so we'd certainly welcome you to raise your hand and we'll talk about anything you got in your mind. So open enrollment started on Monday and goes till Friday the 21st. We are here on the 12th. This is, of course, the time where you can enroll, you can waive, you can add dependents, remove dependents, upgrade your plan, downgrade your plan, whatever it is. This is our one time a year to make all those changes. Any changes you make will go into effect January 1st. We're going to be using the ADP Workforce Now portal as we always do, so no changes there. So that's your timeline. Medical plans available. So there's very little, if any, real changes to you happening at this open enrollment. So this is going to be a really smooth transition. The most important thing to note is that there was a rate increase and it's being absorbed by the company. So your rates are going to stay the same as they were last year, which should be very welcome news, especially in this current environment where rates, the big talk in America is, of course, the cost of healthcare. So plan benefit designs are staying the same, rates are staying the same, HRA contributions are staying the same. So we still have our three different plans. We've got our Select Network HMO. This is the smaller group of providers. Then we've got our full traditional HMO plan. This is the full group of HMO providers for some people in more remote parts of California. The traditional HMO network is going to be the network of choice for you. For those of you in more populated California cities, the Select Network is going to be a cheaper option, not have quite as many providers, but still great care. And then for anybody outside of California, we have our one PPO plan. We have that PPO $3,500 deductible plan. California employees are eligible for all three of these. Outside of California, it's just a PPO, the classic PPO plan. So here's a side-by-side of what that all looks like. Again, same benefits. Everything's very similar to what you saw last year. We got our lower cost plan on the far left. We've got our full network HMO plan right there in the middle, and we've got our PPO plan on the far right. PPO plans give you a lot more choice of provider, a lot more opportunities on who you can enroll with and see, but it's going to cost you more out of your pocket, and there's more cost sharing in terms of deductibles and out-of-pocket expenses. So you can see there at the bottom, the rates are staying the same as they were last year. So this should be a pretty easy renewal overall for everybody. So just kind of a review, we have our HRA product. Last year was our first year using this HRA product. And what we're doing is we have a $750 contribution for people enrolled by themselves and a $1,500 contribution for people enrolled plus any dependents, plus one child, plus a spouse, plus a family, whatever it may be. These dollars are used to meet some of your out-of-pocket expenses. As we know, we put deductibles in place last year. This was made to meet as much as half of that additional expense. You should be using these dollars for anything that your medical plan covers. So anything like doctor visits, prescription drugs, blood work, MRI, surgeries, urgent care, hospital, anything that's part of your medical plan is something that you can use your HRA funds for. You cannot use the HRA funds for dental and vision. This is a medical only plan. There has been some decent amount of usage of the HRA this year. Reminder that if you have medical expenses that you've not been reimbursed for, you can still ask for reimbursement before the year is over. Okay, so please note that. And then there is a time frame. If you had a claim, say December 30th, you do have a period of time to be able to get the EOB for that, submit that, and get reimbursed. So we are anticipating a number of you have waited and saved up your expenses and are going to submit it all at once. You can certainly do that. If you have any issues or having trouble with that, the WEX folks can help you. If you continue to have trouble, we're happy to help as well. New this year, we're going to be offering a WEX benefit card. You should be receiving these right around the first of the year. This should make some of the process easier. Your HR team heard some direct feedback that accessing the HRA funds was a little bit challenging for some people. There was some hoops to jump through that made it a little difficult for some of you. We hear you, and this is probably the biggest change of open enrollment is this new WEX card that will be coming to you. That will help. You can swipe it right at the point of sale for many services, and the charge will come off the card there. You don't need to incur this expense and then submit. This doesn't work for absolutely everything. Sometimes you still need to substantiate claims. Sometimes there's more information necessary. But our team will be working with the WEX system to build in all of the copays, all of the different things that you have as part of your plans. There's, 100 different data points. If we plug it in, it should make your experience a little easier. It should make it more likely that the benefit card does work for you at the point of sale. So we heard that some of you had some trouble. This should answer some of those issues for you. How do they work? So there is something, merchants have something called the IIAS, the Inventory Information Approval System, that is part of their SKUs on the different products they sell, like prescriptions, like doctor visits, whatever it may be. And the card that you're using has something also programmed into it so that you can't use it to go buy a pair of tennis shoes. You can't use it to buy groceries, but at a CVS, it could work, or at Dr. Smith's office, it would work. So they have some technology built into it so it can recognize where you're spending these dollars and make the process a little easier. Co-payments should be auto-approved. If you have a recurring claim that's happening, a recurring prescription drug, recurring MRI, you can use your debit card to set up recurring claims. So that can be helpful. Again, trying to make this a little easier for you. The card will automatically be mailed to you. You will get 2 of them. It will go to the address listed on your account. So whatever you've listed as your home address is where this will go. And then if you need additional cards, you can request them. There is no charge for this. If you get a lost one, you can just get a new one. And then there's some questions about children getting an ID card or a debit card. So you will get 2 automatically for free. And if you want one for your child, they must be 18 years or older. Okay, so if you have a dependent that's on the plan that's over 18 years old and you want them to have their own debit card for the HRA, you can get that. You can request that directly from WEX. So let's talk about WEX and the mobile app. We talked about this last year. This is a recycled slide here, but it's very important that all of you have this app on your phone. It can improve your experience. So make sure you download that app on the QR codes on the screen. If you already have it, you can also just go into the App Store and look for the WEX Benefits app. There's lots of things you can do in here. You can reimburse yourself. You can send payment. You can look for things that could be eligible or not. You can view and upload receipts. So lots of different things that can be done within the mobile app. The participant services team is really your first stop. If you're having trouble with the app, you're having trouble with the reimbursement, the debit card, whatever it may be, I recommend reaching out to the participant services team. They've got really great hours Monday through Friday. They are generally very helpful. If you find you are not getting the help you need after reaching out to them, then yes, please talk to the HR team, get in touch with us, and we'll step in and see what we can do to smooth out whatever sticking points there might be. Again, lots of help is available. Another plug for the app there. For those of you that might not be enrolled currently and have questions, there is kind of a separate number for questions before you enroll. So there's a different 800 number there that can kind of walk you through what you're doing and how you do it. Very helpful stuff available for them. back to our plans. Remember, two plans. We talked about this: select network, full network. You can find a doctor at anthem.com/CA. Click the find a doctor button. You will go right to the find a doc page here, where you're gonna, if you already have a member ID, if you already have a login, go ahead and put it. That will save you some time as far as where your location is, as far as what plan you currently have. But you can also just search as a guest here. You'll do a drop-down medical plan. You'll use California. Yes, even for those of you outside of the state of California, this is the state in which the plan is offered. Okay, so Pro Energy is a California-based company, so you are going to select California here. Medical through employer sponsored. And then as you hit this drop-down menu, there is a ton of options. There's really the two different options, the three options you're looking for. Here's your prudent buyer PPO. This is, if you're on a PPO plan, that's your network. The limited network HMO plan, here you're going to look for select HMO. And then if you're looking for the full network HMO, it's called the Blue Cross HMO California Care Large Group. That's a little bit further up. This is obviously an alpha order. So you'll select the one that works for you there, and you'll get into this next page where you can search by your county. You can search by a doctor name. If you're looking for a primary care doctor only, you can do that. If you're looking for the lab work, imaging, hospitals, you can search by however you need to. And then a little plug for urgent care. I recommend all of you have a good idea of where the nearest urgent care center is to your home and maybe even to your workplace, so that when you have something urgently of need, you know where to go, you know where it's in network, rather than going to the emergency room, which could cost you a lot more money than an urgent care place. So if you do nothing else from this whole thing, log into the Anthem search, find urgent care near you that's in network, and just know where that is. Share that with your family, so if there is an urgent need, you know exactly where to go. We have another app, the Sydney app with Anthem. This is a very important one. Again, the number one thing you can do to improve your healthcare experience is have the Anthem app downloaded on your phone. You can set up doctor visits, you can view claims, you can request prescriptions, you can do telehealth visits. There's all kinds of things you can do through the app, and that's where you're going to get access to a lot of these things. There's also the well-being solution. So different activities that you complete, you can earn money. So if you have an annual preventative wellness exam, you can get $25. You can get, if you get a cholesterol test, that's another 20. Annual flu shot is 20. So really you can gather these dollars up, and they come to you. The Anthem Blue Cross sends them to you in the form of an electronic gift card up to a maximum of $200. So if you're already doing these things, great. You can also get some help with that. So more offers, more things where you can earn rewards by doing just digital activities. Here's how it all would work. So you select My Rewards, redeem rewards. In the Sydney app. So this is how you would go about claiming those rewards, anthem.com/CA. You got to log in, of course, My Rewards, redeem rewards, and you'll find it right there. Any questions, you can talk through the Sydney app. Again, this is a little deep into the Anthem offering, but if you've got questions, you need help with this, happy to help you do what we can to help you with that. Our dental plan is exactly the same as it was last year. We've got our PPO dental plan, a $1,500 annual max. For those of you who have had this plan and haven't used it very much, and here we are coming up to the end of the year, if you're putting anything off, I really, really encourage you to try to get it done before the year's out, so you start January 1st with the full $1,500 annual benefit available to you. So that's our PPO dental plan. Again, we got the one plan there and no changes. Finding a dental provider is the same way we found a medical provider, except we are going to hit the drop down here for dental, California again, dental, and we are on the Dental Blue Complete Network. Same thing with vision, keeping things exactly the same as we had it last year, nice and easy. It's the Blue View Vision plan. Everything is there's no copay for an annual eye exam, no copay for lenses on an annual basis, and you have a $150 allowance for frames or contacts if they are elective. So if you are electing to use contacts, that same $150 allowance for the frames is the contact lenses. It's an or benefit, not an and. So if you use it for frames, you'll have to wait till next year to use it for your lenses. So the every calendar year nature of this benefit is good. This is a mark of a good vision plan. A lot of vision plans make you wait every 2 years for the frames and contact benefit. This plan is every year. So if you got frames this year, get new contacts next year. Finding a vision provider works exactly the same way. We're going to drop down Vision, California Vision, and it's the Blue View Vision Network. We also have an employee assistance program that's pretty robust. This is available help every single day of the year, every hour of those days. You can even get up to 4 in-person counseling visits for some things. So this is a great place to start your mental health journey. Very difficult to get into mental health providers ever since COVID. Frankly, there's a lot of us trying to use it, which is great, but the supply of providers has not kept up with the demand. So these EAP programs are so much more important. Even if you don't need help with, live work issues, marital counseling, alcohol, drug abuse, you might find some help with the financial consulting, or even we get this request a lot. I need help getting my parents adult living care. How do I arrange care for them? How can I get help with that? So this EAP system really does do everything from your own personal emotional, mental health journeys to any issues we have with drugs or alcohol, to financial ID recovery, and even elder care support. So lots of really good stuff there. You would use the phone number 800-999-7222 and just tell them you're an employee at Pro Energy. All right. Really key to understand here is your entire household is enrolled in this program, even if you're enrolled by yourself on the medical plan. Okay, so everybody's enrolled in this in your family, even if it's just you alone on the medical plan. So that is a very good benefit there. Now, enrollment, just like what you're used to, you're going to go to your ADP portal for what you're using this for, all kinds of other things as well. Once you get in there, you're going to see right here this open enrollment banner. Now, this particular screenshot is someone who's completed their enrollment. So it says make changes. It's been submitted. This button will be a little different for you. It'll ask you to start your enrollment. Once you go through all of that, you will see back on your homepage that it's been submitted and you'll be complete. As a reminder, everybody is being asked to go through this. Yes, I know you might want to keep everything exactly as it is right now. We're still asking everybody to log in and make these elections. If you are on a plan you plan on renewing as it is, this process should take you very, very little time, frankly. Lots of information regarding benefits, documents, all that kind of stuff. So once you get in there, you're going to see lots of information in there. The Colonial plans are a little different. So here is your contact for Colonial. And then right below this arrow here, it's a little cut off, but there'll be a button for you to continue through the process. You'll manage your dependents. You'll enroll in your benefits. If you need to upload any documents, you can do that. And then once you're all set, you'll review and you'll confirm what your costs will be. So you can see the plan you've chosen, what your cost is going to be. You can get the breakdown of the cost details. It'll give you your per paycheck costs here. So again, same system that we've used over the last few years. So should be pretty familiar to all of you. So next step is to be looking for the email notification, which you should have already received, asking you to log into ADP. If you haven't gotten it, don't worry about that. Just log into your ADP Workforce Now portal and make those benefit elections. Please do so by Friday the 21st. We're only as fast as the slowest person in our group, so please help everybody out by jumping in there, especially if you know what you're going to do, especially if you know you're going to renew as is. Just get in there, take care of it. It helps everybody out. And again, Friday, November 21st is that deadline. If something's going on personally in your life and you need a little more time, reach out to the HR department, reach out to our team as well if you want to schedule a one-on-one to go through the benefits and just understand what's covered and what's best for your family. Maybe you're looking for doctors. Maybe you don't know if your doctor is in the Select network or if you need to buy the full network HMO. So like we talked about, everybody's got to do one of three things: go in there and keep the current coverage, go into the system and make changes or enroll if you're brand new, or go into the system and decline and waive coverage. All right. So for those of you that are declining coverage, yes, We need you to go in every year and make that declination. There is a lot of rules your employer has to follow because they are offering a benefit plan. And one of those is to prove an offer of coverage was made. So for those of you that are declining, we just ask you go in there and waive the coverage. Again, should be pretty simple. So if anybody's got any questions, I'll hang out and answer questions for as long as anybody's here. As you know, your team is always there for you. So I'll leave this up as the last slide here as I take any questions. So you can take a screenshot of this if you got to run. Otherwise, if you need contact with us directly for one-on-ones, go through your HR team and they'll share our answers, our information with you, and we'd be happy to help. So that's the end of my presentation. Thank you guys all for joining.